Welcome to the Disclosure course. This course is divided into 4 modules. First, this module provides the disclosure overview. Second is the introduction to the disclosure process. Third, disclosure of adverse event or harmful event. And fourth, preparing for and conducting a disclosure meeting. Depending on your role within the organization, you may be asked to review one or more of the modules for this course. It is important that you understand the disclosure overview information first, and then access each of the additional modules as required. Your instructor or mentor will guide you with how to use this computer-based learning and how to access your organizational policies and procedures related to disclosure. Please note that the information provided here is generic in nature. Each CCAC and service provider organization will have specific organizational policies and procedures related to disclosure. Learners are reminded that these training materials are designed to support the implementation of local business practice, and local policies and procedures must be reviewed in conjunction with these modules. Upon completion of this module, you will be able to explain the importance of disclosure and why the CCAC has policies and procedures related to disclosure, be able to explain and define adverse event or harmful event, be able to articulate the guiding principles of disclosure. Disclosure policies and procedures are in place to provide a framework for how CCAC clients will be informed about their care and when an adverse or harmful event has taken place. CCACs across the province came together to develop an event management framework that includes disclosure as an important element. Nationally and provincially, there is an increased emphasis on client safety. The following quotation is adapted from the Patient's Perspective letter written by Donna Davis, co-chair, Patients for Patient Safety Canada. For the purposes of this introduction to disclosure, her statement has been slightly revised in that the word patient is replaced with client, and client safety incident is replaced with adverse event. Disclosure should be based on principles of client safety, openness, transparency, accountability, and compassion. Disclosing an adverse event with openness, honesty, and compassion shows respect for the client and family. It shows that the organization is worthy of the client's trust and that the needs of the client and family are paramount. CCAC and service provider agencies that are accredited with Accreditation Canada must have disclosure policies and procedures in place. Disclosure is the process by which an adverse event is communicated to the client by healthcare providers. It is the responsibility of staff to know and understand their role in the disclosure process. An adverse event or harmful event is an unintended injury or complication that has resulted in disability, death, or increased use of healthcare resources, and the event is caused by any care or treatment provided as part of a CCAC care plan provided by healthcare workers, formal or informal caregivers, or as self-care by the client. Some examples of adverse or harmful events are equipment that malfunctions, such as bed rails that malfunction and a client falls out of bed, resulting in a fracture and the client being hospitalized. Wound management that results in infection, and as a result of a weakened condition, a client that was being cared for at home requires additional services. PICC line not flushed as frequently as required that results in the line being blocked and a delay in chemotherapy treatment. Hoyer lift must be properly fastened. Lack of training in how to safely use a Hoyer lift could result in a client fall and potential hip fracture and surgery. CCAC disclosure policies are based upon the specific guidelines or principles. Generally, these guiding principles are that clients and/or their families have a right to be informed about the potential for client safety events and client safety adverse events or harmful events in a timely manner. They need to know that they can expect honest, open, and transparent disclosure of the facts, a timely, respectful, sincere apology, and acknowledgement of accountability and responsibility. They need to know that they will be informed about the details of the event and how it will be avoided in the future. Each CCAC policy includes specific guidelines on what events ought to be disclosed, who ought to disclose these events to clients, to whom the disclosure should be made, when disclosure should take place, how the disclosure ought to be made, what needs to be documented and reported, what follow-up is required. These guidelines will be reviewed in more detail in subsequent modules. Let's take a moment to review an adverse event, harmful event, that resulted in hospitalization.
With no immediate family in the province to assist me. Unfortunately, I've been diagnosed with colorectal cancer. I started my chemo and radiation therapy, and it was ongoing at a consistent pattern for over 2 months. I had a 3-week break from the chemo, and when I went back to the hospital, the chemo was changed to continuous infusion. When the chemo was started in my home, I noticed that the chemo seemed to be running too fast, and a lot of the medication was gone the first day. I called my CCAC case manager, who said she would call my nurse. The case manager then called me back to confirm that the nurse had arrived.
I'm Margaret's nurse, and when Margaret realized that her chemo was running too fast, she called her CCAC case manager. I was notified and responded by coming to her home as quickly as possible. Margaret was correct. Too much medication was being infused. We contacted Margaret's physician, and he directed her to go to the hospital emergency department right away. She was in significant risk and had to be hospitalized overnight. At the time of initial disclosure, the cause was not known as to why too much chemo was infused. Was it due to the pump programming? Was it due to equipment malfunction? Regardless, I needed to explain this to Margaret, as I was the primary individual providing care. The event was related to her medication, and immediate medical attention was needed. I advised her that we would complete an investigation to find out what had happened.
I was angry at first, but once I knew that I was going to be okay, I was relieved. I was also happy that my nurse wasn't being blamed for what had happened. Her agency and the CCAC case manager communicated with me, both on the telephone and through home visits. They explained that the nursing agency, CCAC, the vendor who provided the pump and medication, had met to review the facts so that they could understand what happened, determine why it was caused, and develop an action plan for system improvements. The CCAC case manager came with my nurse. They both apologized in person and sent a letter of apology which outlined that improvements had been made because of the lessons learned from this event. I appreciated their honesty.
We learned a lot through the disclosure process. The care team were able to change processes in a way that would help prevent this kind of event from happening again. Some of these changes were the implementation of a new standardized flow sheet for administration of chemotherapy and review of the process for when a CCAC picks up a pump and how it is tested before leaving it with the client. Most important, our client was satisfied with the resolution to the event, and the disclosure process was a positive experience for her.
So this was an adverse event, as it was a medication error to the client. We met as a team in the team meeting process, and as a CCAC case manager, I met with Margaret to disclose it to her in person of what happened. The service providers were along with me at the meeting in order to facilitate that meeting so we could tell Margaret the facts of what happened to her during this adverse event. We told Margaret what happened, the date, the time. We discussed with her. We told her all the individuals that were involved, that were present during the adverse event, and we told her all the facts that we uncovered during the investigation. We actually talked to her about the system improvements we've made to our organization and the system improvements the service provider made to their organization to make it better. And we're promised Margaret that at the end of this, we would actually follow up with her in a couple of months to ensure that we are making those system improvements in order to prevent further reoccurrences to any other client. So by doing this disclosure process, we provided the respect the client deserved by ensuring that she knew what was happening to her in her health care treatment. We provided the apology and sincerely apologized to her what happened, because we knew that she did not have to go through this process. We told her that we supported the staff in our process of the disclosure process. We explained to her that the staff were supported along the disclosure process as they were part of the disclosure meeting with the team, and we explained to her that the staff were given the right to be heard on what they felt happened within the system that resulted in the system failures. In addition, we explained to her that we do have a provincial event management system, that we actually report our incidents so that we can look at trending and system improvements, not only as a local CCAC, but as a global CCAC, and that we're always looking at continuously improving across the organization.
The importance of disclosure is reflected in current literature, highlighting ethical, professional, and legal considerations that support open and honest disclosure. There are legislative, regulatory, and accreditation standards that recommend or mandate disclosure processes. When a CCAC is the primary organization involved in an adverse or harmful event, it is responsible for full disclosure to the client about that event as soon as reasonably possible. When a service provider is the primary organization involved in the care which resulted in an adverse or harmful event, it is expected that the event will be disclosed by the service provider organization at the time of the adverse or harmful event or shortly thereafter. The service provider will advise the CCAC of the disclosure and may request that the CCAC participate in the disclosure process. Remember, disclosure is often an ongoing dialogue and is a collaborative process. The purpose of a disclosure policy is to provide guidance to healthcare providers on the task of disclosing adverse or harmful events. Policies clarify the role of CCAC staff and service providers in the disclosure process. It also provides opportunities for staff and service providers to learn how to improve the quality of care and improve client safety through the management of adverse or harmful events. Disclosure policies support a just culture. This promotes learning from adverse or harmful events and close calls or near misses. Healthcare providers and their clients are supported and educated to prevent similar events. Disclosure demonstrates to clients that they can trust healthcare providers and organizations. It demonstrates to staff that they can learn from their mistakes. A just culture is not a culture of blame or error. A just culture is a shared commitment to implement improvements and share lessons learned. There is an awareness of what is expected, and when analyzing adverse or harmful events, accountability of healthcare providers is determined fairly. In a just culture, the interests of both providers and clients are protected. Healthcare providers who are involved in an adverse or harmful event can be confused about what to do. Often, healthcare providers are not prepared for the emotions that they will experience when they are involved in an adverse or harmful event. Remember, an adverse or harmful event is an unintended injury or complication that has resulted in disability, death, or increased use of healthcare resources, and is caused by any care or treatment provided as part of the CCAC care plan that is provided by healthcare workers, formal or informal caregivers, or as self-care by the client. This was an adverse or harmful event because additional resources were required, hospitalization that was caused by healthcare management. The moral residue felt by staff was actually lessened by the fact that the agency had disclosed and learned from the event. The agencies involved worked with the CCAC and the members of the healthcare team to review the facts and to do a root cause analysis to understand why this happened and what system improvements should be implemented by the agency as well as the CCAC. CCAC clients expect to have access to safe healthcare services of the highest possible quality. Approach all events with the attitude that disclosure is the right thing to do. Ask yourself, is this something that I would want to know if it happened to me or to someone in my family? Remember, when it comes to disclosure, honesty is the best policy. A fundamental principle throughout the disclosure process: commitment to learn and to ensure mechanisms are in place to reduce the risk of reoccurrence.
Okay, so we wanted to talk a little bit today about the kind of environment that we're wanting to create at the CCAC, and through the Quality Care Connector and the language that we're looking at around just culture and the environment in which to disclose an adverse event. The kind of environment that really helps us to disclose adverse events to clients. So perhaps you have some ideas of what that environment looks like.
To me, it means being a fair process in a safe environment for our staff, our service providers, our healthcare, hospitals, our physicians. The whole healthcare system needs to be involved, and they need to feel safe as we through the disclosure process. So what do you think, Kathy?
I think definitely, it's about that, as well as ensuring that we're always thinking about client safety and what improvements can we make to our system so that the situation that occurred won't occur in the future or will be minimized.
Just culture is about no blame, so that makes it a safer environment for staff to report adverse events. So if they're reported, then we can learn from them and we can look at systems improvements.
What improvements can we make to our system so that the situation that occurred won't occur in the future or will be minimized? So those are the kinds of things I think about when I think about just culture, but also in addition to the client safety, as you mentioned, the safety for our staff as well. As long as they can ask all the questions and those who are disclosing come forward with the information in an open, honest way, that'll improve the experience for our client as well.
And that really helps to de-escalate the situation for the client. It reduces the suffering of the client when we get back to the client in a timely manner. We quickly get back to them to let them know we're looking at the root cause, that there are a number of different parties involved, so we have to gather the facts.
So that they are fully informed at every step of their process in their healthcare journey, that they have a right to know if something undue has happened to them, that we are taking it seriously and that we are looking at ways to make it better for them.
When clients have no response, no one's getting back to them at all, they sit and they worry and they get very upset that no one has contacted them to let them know about a serious issue that's occurred to them, the adverse event, or what are the causes of that event. So they may escalate it after a while. They tend to be quite patient at first, but then that could lead to them calling a lawyer. So as we're thinking about disclosing and treating the client with respect, we're also treating our staff and our service provider with the respect that they deserve, because it can be quite devastating for the staff member when an adverse event occurs and they've been involved. So it acknowledges their feelings and provides support for them.
Because when you think about our clients, they sometimes don't differentiate between the service provider and the CCAC case manager. So we're all in this together to try to improve the system. So it's really important that CCACs and the contracted service providers address the issues collaboratively to make improvements.